Okay, welcome back. We will continue our lecture series in pharmacology for health professionals. In this video, we will discuss chapter number 24, Anesthetic Drugs. Learning objectives for this chapter: describe some historical milestones in the discovery of anesthetic drugs, compare and contrast how local, regional, spinal, and epidural anesthesia drugs are given, explain the significance of the letters MPF and the trade name of some anesthetic drugs, describe various categories of drugs that are given preoperatively and their therapeutic effects, compare and contrast how barbiturate drugs, narcotic drugs, inhaled anesthetic gases produce general anesthesia. When given the name of a well-known anesthetic generic drug, identify its trade name. When given the generic and trade names of an anesthetic drug, identify what drug category it belongs to. When given an anesthetic drug category, identify several generic and trade name drugs that fall in that category. And when given an ending common to several generic drugs, identify the related drug category. Alright, first a quick introduction. Anesthesia is the absence of feeling, sensation, or pain. Now, this can be obtained on the skin by a topical application, in the skin or deeper tissues by a subcutaneous local injection, also in a body part by a regional nerve block. It can also be obtained in the trunk and lower extremities by an epidural or spinal anesthesia, or throughout the entire body by general anesthesia that produces unconsciousness. First, we'll start off with topical anesthetic drugs for the skin and eyes. Anesthetic drugs that are applied to the skin can be applied in form of a cream or a gel or an ointment or a spray. Alright, now we'll talk about local, regional, spinal, and epidural anesthetics. For local anesthesia, this is an anesthetic drug given by a subcutaneous injection into the skin. This will anesthetize a small area of skin and some adjacent tissues, and this is used for minor surgical procedures. For a regional anesthesia, this is an anesthetic drug that's given by a subcutaneous injection near a nerve plexus, which is a group of nerves, and its branches. Now, this is used during surgery on an extremity. Now, this will provide anesthesia just for that region. It's also known as a nerve block anesthesia. Alright, in this image we have an illustration of how a subcutaneous injection of anesthetic drug would look. If you're doing local or regional anesthesia, the needle should be placed at a 45-degree angle to the skin, and the needle should only go to the subcutaneous layer of the skin, not to the muscle, the subcutaneous tissue. When it comes to spinal anesthesia, this is an anesthetic drug that's given by injection into the subarachnoid space between the vertebrae and lumbar region of the back. An epidural, this is an anesthetic drug given by injection into the epidural space. And this will move into the subarachnoid space to produce anesthesia. And here we have a cross-section of a vertebrae plus the spinal cord here. And this whole structure here will be the spinal cord. And the space between the cord itself and then the vertebrae is filled with fatty tissue and also a good amount of blood vessels. So this is the epidural space because it's just above the dura mater of the spinal cord, which is the meninges that cover the spinal cord. So the drugs will be injected into this epidural space here. Some examples of various local, regional, spinal, and epidural anesthetic drugs: bupivacaine, also known as Marcaine or Sensorcaine; chloroprocaine, sold under the trade name Nesicaine; lidocaine, also known as xylocaine; mepivacaine, also known as polocaine or carbocaine; procaine, more commonly known as the trade name Novocaine; ropivacaine, also known as Nerapin; tetracaine, also known as its trade name Pontocaine. Like many other of the drugs that we've covered, the various body systems, it's common to see combination drugs, and that's the case here with anesthetics. And these are used to provide local or regional anesthesia. A good example of this kind of drug would be duocaine. This is a combination of the drugs bupivacaine and lidocaine. Now we'll move on to a focus on healthcare. Now, some trade name drugs, Nesicaine MPF, Sensorcaine MPF, and so on, contain the abbreviation MPF. And those letters stand for methylparaben-free. Now, methylparaben is a preservative that's found in antibiotic and antifungal drugs and often present in liquid anesthetic drugs that are in vials or in ampules. Now, some patients have an immediate allergic reaction to methylparaben, so this has been eliminated from some anesthetic drugs. So drugs that don't have this compound are labeled as MPF because they are methylparaben-free. Nesicaine MPF, xylocaine MPF, for example. The local anesthetic drug bupivacaine and lidocaine are available with or without epinephrine in solution. Now, epinephrine, which is more commonly known as adrenaline, is a powerful vasoconstrictor that decreases blood flow to the tissues where it is injected. Now, this therapeutic effect controls bleeding and prolongs the anesthetic action of the drug. Now, the use of epinephrine is contraindicated in certain areas of the body, such as the top of the nose, the fingers and toes, and ears, because the blood supply there is limited, and excessive local vasoconstriction could lead to necrosis or tissue death, and then the skin would slough away as it dies. So in these areas, an anesthetic drug without epinephrine is used for a local anesthetic. Now move on to an historical note. For centuries, the South American Indians chewed on the leaves of the cocoa bush for their euphoric effects. Now they got those euphoric effects due to the presence of cocaine. Cocaine is derived from these leaves and was recognized as a topical anesthetic drug in 1880 and is still actually used as a topical anesthetic and vasoconstrictor drug for some ENT procedures. For many years, a synthetic substitute for cocaine were sought, and this led to the discovery of procaine, commonly known as Novocaine, which is the prototype for local anesthetic drugs. Okay, now we'll move on to drugs that are used during the preoperative period. Now, various categories of drugs are given preoperatively to provide sedation, as well as to dry up oral secretions to facilitate endotracheal intubation and antihistamine drugs. A category of drugs that could be given are antihistamine drugs. These help to provide sedation. These also will act to dry up any oral secretions to facilitate endotracheal intubation. Some examples of drugs that would fit in this category: hydroxyzine, also known as the trade name Visteral, and also promethazine, which is known as its trade name Phenergan. Another class of drugs that are used during this period are anticholinergic drugs, and these work by blocking the action of acetylcholine. These will decrease oral secretions to help facilitate endotracheal intubations. And some examples of this category of drugs would be atropine and scopolamine. Another class of drugs that could be given in a pre-op setting: anti-anxiety drugs. Of course, these are given to relieve anxiety and to provide sedation. These are given prior to endoscopy or cardiac catheterization or minor surgical or dental procedures. And even after these drugs are administered, the patient is able to respond to commands from the medical staff, but they will have little or no memory afterward of the procedure. Some examples of anti-anxiety drugs: chlordiazepoxide, diazepam, also known as Visteral, lorazepam, also known as Ativan, and midazolam. Another category of drugs could be given are narcotic drugs. These are given to relieve pain and also to provide sedation. There are multiple kinds of narcotics that could be used in this way. Some fall under the category of Schedule II drugs, which would include levorphanol, which is known as levodromeran, meperidine, also known as Demerol, morphine, also known as Duramorph, oxymorphone, also known as Opana or Namorphin. Again, all of these are Schedule II drugs, so these are very, very strong and very easy to become addicted to. Some drugs that are used during this period could be Schedule IV drugs, and some examples of this would be butorphanol, also known by its trade name Stadol, and also pendazacine, also known as Talwin. The other types of drugs that could be used here are sedative or hypnotic drugs. An example of that would be chloral hydrate, also known as Somnote. This is a Schedule IV type drug. Droperidol, another example of this kind of class, and also dexmedetomidine, which is known by its trade name Precedex. You can also have barbiturates that are given. These will produce sedation, and these are going to be Schedule II drugs. Some examples here: pentobarbital and cigobarbital, and that's better known by its trade name Seconal. Another class of drugs could be given here: antipsychotic drugs. These are given to help decrease anxiety. An example of this kind of drug would be chlorpromazine. Alright, now we'll talk about drugs that are used to obtain general anesthesia. Now, anesthetic drugs are given to maintain general anesthesia throughout a procedure in an operating room. And these may be given intravenously or by inhalation. When it comes to intravenous drugs for general anesthesia, these work very rapidly and provide a rapid loss of consciousness. And these help the anesthesiologist to initiate anesthesia quickly while minimizing the patient anxiety. Now, IV drugs for general anesthesia could include ultra-short-acting barbiturate drugs, or narcotic drugs, or sedative drugs, or anti-anxiety drugs. Now, some drugs are used by themselves to provide light sedation during a short procedure. Usually one or more of these drugs is used in combination with an anesthetic gas to provide a balanced and sustained level of general anesthesia. Now, these are classified as a Schedule II, III, or IV drug, but the short duration of use during surgery eliminates the possibility of addiction. A quick historical note: In 1874, Dr. Orr of France demonstrated the first use of intravenous anesthetic drugs during surgery, and in 1920, the technique of endotracheal intubation was perfected. This allowed greater control of patient ventilation and anesthetic administration during a surgical procedure. All right, now we'll talk about another class of drugs that are used to obtain general anesthesia. Those are barbiturates, and these induce general anesthesia, and when they're used in combination with other drugs, help to maintain general anesthesia. And these act by depressing the central nervous system and produce sedation. Now, in higher doses, these can produce unconsciousness, but these have no analgesic effect. They don't relieve pain. An example of this type of drug would be methotrexate, which is also known by its trade name Brevital. In this image, we have an example of Brevital. The capital C of the Roman numeral 4 indicates this is a class 4 scheduled drug. Now we'll talk about a drug controversy. In 1935, the drug thiopental, also known as pentothal, which is a barbiturate drug, was found to rapidly induce general anesthetic drug administration when it was given intravenously. Now, until recently, this drug was always included in lists of barbiturate drugs used to produce general anesthesia. This drug was also used for many years during executions on prisoners who are on death row. Now, the cost of one dose for a lethal injection was $8,000, which is much higher than the cost of the drug when it was used during surgery. So many drug companies stopped producing it because the company's shareholders objected to executions on moral grounds and concerned about the public's perception of their company. And in 2014, one drug company was named in a lawsuit by a death row inmate. Now, states that have the death penalty have been trying new drugs and new protocols. Now, this has delayed executions and raised challenges that those kinds of drugs might cause death in an inhumane way. Now, some state officials are discussing going back to the use of the gas chamber or the electric chair for executions. Another kind of drug that could be used to obtain general anesthesia are narcotics. These are used to induce general anesthesia, and when used in combination with other drugs, to help maintain general anesthesia. And these work by binding to opiate receptors in the brain to block the pain. In higher doses, these can produce unconsciousness. Now, depending on what type of narcotic is used, it could fall under a number of different schedule categories. Some narcotics that are used are Schedule II drugs, and those include alfentanil, fentanyl, meropenem, which is also known as Demerol, morphine, known as the trade name Duramorph, Nubifine, which is also known as Nubain. Some other examples of Schedule II narcotics used for general anesthesia: oxymorphone, which is known as Numorphin or Opana, pentazocine, also known as Tailwind, remifentanil, also known as Ultiva, and sufentanil, which is known as Sufenta. Some examples of Schedule III narcotics used for general anesthesia: ketamine, also known as Ketalar. A Schedule IV drug would include fospropofol, also known as Lucedra, also midazolam is also a Schedule IV. And some examples of narcotics that are not scheduled include etomidate, which is known by the trade name amidate, and propofol, which is known as Diprivan. In this image, we have an example of an ampule of sufentanil, and again the large capital C with the Roman numeral 2 indicates it's a Schedule II drug. And because it's an ampule, it would have to be broken off here at the neck. And like all ampules, once it's open, all the drug has to be used or disposed of. You cannot reseal any kind of drug that's stored in an ampule. Another type of drug that can be used for general anesthesia are inhaled gases. These are used to induce or to maintain general anesthesia. And these are often used in conjunction with one or more intravenous anesthetic drugs. These are some examples of inhaled gases that could be used for general anesthesia: desflurane, also known as suprain; enflurane, known by the trade name ethyrane; isoflurane, known as forane; nitrous oxide; and the last one listed here, sevoflurane, which is known by the trade name Ultane. Okay, now I'll mention some quick historical notes. See, the first mention of general anesthesia is in the book of Genesis, when God caused a deep sleep to fall on Adam prior to removing a rib from his side to create Eve. Now, for many centuries, the only pain relief available during surgical procedures was that from opium or from alcohol. Now, these drugs failed to produce complete anesthesia, and surgeries had to be performed as quickly as possible, with assistants holding down the patient. In 1772, nitrous oxide was discovered. Now, rather than being utilized as an anesthetic drug, it was inhaled at social parties to produce euphoria, and was commonly known as laughing gas. Now, nitrous oxide was not recognized as an inhaled drug that could produce general anesthesia until the 1860s. Now, during the first half of the 1800s, surgery was performed without the benefit of general anesthesia. In 1846, William Morton, a Boston dentist, recognized that inhaled ether could produce general anesthesia. And he gave the first public demonstration of surgery performed under an ether anesthetic at Massachusetts General Hospital. And the word anesthesia was coined at that time to describe the effect of ether. However, it has an extremely unpleasant odor. It's also highly explosive and frequently produced severe postoperative vomiting. So its use was discontinued in the 1960s. At approximately the same time that ether was discovered, the Scottish obstetrician James Simpson introduced the general anesthetic gas chloroform. Now, chloroform has two advantages over ether. It has a much more pleasant of an odor, and it is not explosive. However, it is much more toxic, and its use was associated with a higher mortality rate. So its use was discontinued after World War I. So within the scope of 17 years, the first three general inhaled anesthetic drugs, ether, chloroform, and nitrous oxide, were introduced. And only nitrous oxide is still in use today. In 1929, the fourth general anesthetic drug, cyclopropane, was discovered by accident doing research on another chemical. Cyclopropane was used widely until the late 1950s, where its use was curtailed due to the danger of explosion in operating rooms that then contained much more electrical equipment. So no further advances were made within inhaled anesthetic drugs until 1956, where halothane was developed from research with fluorine, and this research was conducted during World War II in an effort to produce the atomic bomb. Halothane marked the beginning of a new category of inhaled general anesthetic drugs that are still used today. Alright, now we'll move into neuromuscular blocker drugs that are used during general anesthesia. These are given intravenously, and these act by blocking nerve transmissions throughout the body to reduce resistance to endotracheal intubations. And by doing so, we'll end up producing a relaxation of skeletal muscles. Now, this is particularly important during abdominal surgery, when the muscles of the abdominal wall must relax in order to allow adequate visualization of the operative field. Some examples of neuromuscular blocker drugs: atracurium, which is known by the trade name tracurium; cystatracurium, also known as Nimbex; mevacurium, also known as Bevacron; pancuronium; rocuronium, known by its trade name Zemaron; succinylcholine, also known by its trade names Anectine or Quilicin; vecuronium, known by its trade name Norcuron. In this image we have an example of a vial of succinylcholine. Something that's fairly obvious about these vials of this drug is a bright red cap, and it says in very clear letters, this is a paralyzing agent, so it's not mistaken for any other kind of drug in a vial of this size. Now, after these kinds of drugs are given for surgery, there are drugs given to reverse those effects of neuromuscular blocker drugs. So these are muscle strengtheners. Some examples of this class of drug would be edrophonium, which is known by the trade names Reversol or Enlon; neostigmine, which is known by the trade name prostigmine; pyridostigmine, which is known by its trade name Mestinon. Now we have another historical note. For centuries, the South American Indians would use arrows dipped in the drug curare for hunting animals and also in battle. Now, this drug would cause death by muscle paralysis. Now, this drug was unknown to the rest of the world until 1595, when Sir Walter Raleigh brought it to England. Now, not until the 1940s, though, was curare introduced as the first neuromuscular blocker drug to be used during general anesthesia. Now, until that time, abdominal surgery presented a challenge for both the surgeon and also the anesthesiologist, because the abdominal muscles would remain taut and unyielding, except during the very deepest levels of general anesthesia. But with curare, the anesthesiologist could maintain a lighter level of general anesthesia while still obtaining complete abdominal wall relaxation. Now, curare has been replaced with a modern neuromuscular blocking drugs that have the same drug effect. Okay, that brings us to the end of this chapter, chapter number 24. We will conclude our lecture series on pharmacology for health professionals with our next video, which will be our last video on chapter number 25, emergency drugs, IV fluids, and blood products.